Hey, it's Dr. Hannah with this week's Hot Topic. Today I want to talk to you about healthy cholesterol levels and why you should maintain that healthy cholesterol level. Now, most people know that there is two types of cholesterol that we need, and again, you do need cholesterol in your body, so don't think that you want to completely eliminate all cholesterol. There's a good type of cholesterol and there's a bad type of cholesterol. So the HDL is more associated with the good type. That's the one that keeps our arteries open, makes them nice, healthy, springy. Then you have the bad cholesterol, which is the LDL, which is the one that causes the narrowing, the hardening of the arteries, things that you don't necessarily want. You want a good ratio between the HDL and the LDL to be about 2 to 1. The best way that you can get your healthy cholesterol levels is through diet and exercise. I know that seems a bit like duh. However, most people just want to take a simple medication to lower it and don't want to change anything. I'm not a huge proponent of that, but diet and exercise is, again, it's way healthier for you. But if you don't like medications, there's also supplements that you can take. Again, it's your choice. There's no right or wrong. It's you have to be comfortable with it. Personally, I won't take a medication to control that. Now, I understand that sometimes people have genetic things like hemochromatosis that naturally will increase your cholesterol levels. That's a whole other thing. But again, diet and exercise is something that it's a really simple way to get healthy cholesterol levels. So today I want to talk to you about if you don't control your cholesterol levels, what potentially could happen to you. So kind of keep that in the back of your mind if you're like, meh, cholesterol doesn't seem like it's a big deal. It kind of is, especially if you ignore it. So these are things that you're setting yourself up for. First thing is that most people associate high cholesterol with is heart attack. Now, if you have high cholesterol, and especially the bad cholesterol, it is going to block your arteries. If you have a blocked artery, it means there's no blood flow. If you don't have a blood flow going to your heart, that's a heart attack. That's kind of the most basic thing, that the way to describe what a heart attack is. So no blood flow to the heart, freaks out, it needs something, so it panics, it dies, that's a heart attack. Now, the other thing that can happen is when you have that blood flow blockage, if that blockage actually breaks away and it goes to the brain, that's called a stroke. So those are the two most common things that people associate high cholesterol with, is heart attack and a stroke. But there are a couple other things that you may not necessarily realize that that's also related to your high cholesterol that you probably should pay attention. The other thing, it makes an effect on the memory. So going with the stroke, if your brain is not getting enough blood flow, not getting enough oxygen, because oxygen is carried by the blood, that's going to cause some memory issues. It may mimic dementia, all those things. Like you might be a little bit more forgetful. That potentially could be that you have too much cholesterol. Other thing with the blocked blood flow, it can cause peripheral arterial disease, and that mostly affects your periphery, so your hands, your feet, nothing that's not in the core. And so if you don't have blood flow to those areas, you can lose sensation, you can have numbness and tingling, you can just, if you don't have that blood flow in that area, your body just doesn't want to use them. So it's kind of that thought process, if you don't use it, you lose it. If you don't have blood flow, just kind of like the heart, things are going to start to die. They're not going to function as well as they should. So that's what peripheral arterial disease is. It's basically, it's not getting enough blood flow to the area, and then those things start to shut down and not work properly. The other thing that some people don't necessarily associate high cholesterol with is gallstones. Your gallbladder is in charge. It's a big digestive organ. And so what happens is if you get a lot of cholesterol in your system, your body doesn't know what to do with it. So your gallbladder takes it over and is like, hey, I'll take all the sludge for you. And it starts to form these little stones. Well, these little stones can cause blockages in your gallbladder, can cause a lot of pain, and can cause a lot of damage in general. So that's something else that you don't want, that if you would just maintain your healthy cholesterol levels, you could avoid. So those are just some basic reasons on why it's super important to maintain and watch your cholesterol levels. Again, diet and exercise is the easiest way. There are supplements. And if you want to do something else, there is also medication that you can take and talk to your doctor. So that is all I have for you guys this week. We'll see you guys next time.